Hey everyone, welcome to your health partner with Lehigh Valley Hospital, Hazleton. We have a lot of information for you today. I'm very excited to have the president on the show today, Tammy Torres, doing a fabulous job in Hazleton, and it's good to have you with us.
Thank you.
Okay.
Happy to
a lot
be
of things happening.
Oh, absolutely, always. We're a very active hospital, right?
Yeah, I was telling you that, when my wife and I are going some places, if we're at Boyer's shopping or if we're here at the Laurel Mall, people will come up and they appreciate the fact that, we're giving them health information every day, in fact, through the hospital. And so it's good to know that, as you say, your health partner, that's what you are.
Mm-hmm. Absolutely.
And I like that, you're a health partner. How you doing?
I'm doing very well. Thank you for asking.
So
Happy New Year.
Yeah. How many grandchildren do you have?
I have 5.
5. And you're only 40 years old.
That's right. It's amazing how that happens, right?
It's amazing. I'm telling you. Everybody's in good shape?
Everybody's doing well, thank you.
Are you having fun up here?
I am. I love it. I love it. I've been here 20 months, so the last time you saw me, I've seen your show lots of times, but present here 20 months now in this area. So
good.
Love it.
What do you find that you like about the area?
I love the people. I think they're genuine, and it's hard to find that anymore, and very sincere in their approach, and so they don't hold back when they're giving you feedback. And that's the way I feel that we run the hospital, with that feedback, and try to make it better as we hear from them in the community.
Tammy, you're very hands-on.
Yes, I am.
And that's great. You're not just sitting in your office and that's it, but I think that's, you're there, and I think that's very important, especially being the president, and you're open to whatever criticism, comments, whatever, okay? Am I correct in saying that?
Absolutely, and I think the basis of the presence is because I started my career as a registered nurse. So I understand the challenges. I've been on the receiving end, receiving that care, and the significance of how we interact with our patients, and how they perceived us, whether we're sincere or not when we come to them, when we sit and when we hold their hand, when they're having issues. And I've also been in the back end as the administrator, as leading a hospital, and then when you hear when things don't go right. So, it is the way I've always led, because I understand.
We talked about the merger, okay? When a merger happens, okay, why do you merge, okay? And why did the hospital merge with, great health group, Jefferson? Couldn't get any better. But what happens that the merger happens? Like, why do you do that?
So we merge to be able, first and foremost, is the stability to make sure that we always have hospitals in all the right places. But more important, this merger was really based on a health insurance that they have that I feel that we're going to be able to offer to our colleagues and also to the public. So that's going to be very important to be able to have that level of insurance. So we're working through that process right now. What is that going to mean, and make it affordable for anyone that chooses this health care plan.
When is this going to be kicked off, the health?
We're actively working through that right now. So it's going to take some time because we're all in different counties.
I see.
So our county, Luzerne, is going to take a little bit longer to go through that process.
When I was talking to Terry the last show, he mentioned how, this is a great program, okay, health program, and I think it's, going to be something really good for the area.
I believe so. I think it is. But the biggest, thing that we are going to be able to offer the community is the vast services between such a big organization that they have and our organization. There are 19 hospitals, we're 13, so now over 30 hospitals. And now we're going to have the availability from really the Poconos down to the shore. You will meet along the way one of our facilities. And so, like we say, we're stronger together.
Yes.
We have things that they don't have, like burn services. They don't have that, but they have a school, medical school, nursing school, that we can capitalize on as we look at all the shortages throughout, the nation. And so really taking those that we do educate and putting them in our system. And now we can offer them anything from the shore down to the mountains and everything in between.
Being in business, okay, you need leadership. And I think that's critical in terms of when you're looking at the entire organization, when you look at Nestor and you look at Joe.
Joe Cashone,
yeah.
he is.
So let's talk about the fact that, you really have some strong people here, okay, that really understand what's happening and leading the troops, as they say, in the right direction in healthcare, okay. I think, talk a little bit about those particular leadership qualities that we have in this organization.
Excellent. I mean, when I started with Brian Nestor, very personable, was open to recommendations and suggestions, had a vision of where he wanted to take LVHN, knew that in order to be successful, we needed to have a healthcare plan, and really reached out and researched, and that's how we became part of Jefferson, because they had that critical piece that we would like to have, and hence this is why the merger occurred. And now we have Joe Cashone, again, a very visionary person, really interested in all, he likes flagship hospitals, our very big one, like Cedar Crest, like Thomas Jefferson, but all the way down to the community level. And so he had the opportunity to come out and visit us at Hazleton, and he just loved it from the minute he walked in. You feel the difference. You feel that you are taking care of your neighbor. Some of that sometimes at the bigger hospitals are lost.
Yes.
And here he really felt it and met with the colleagues who had their stories to tell. In fact, one of our colleagues, unbeknown to any of us, reached out to him directly, one of our pharmacists, and said, you got to come down to Hazleton. You've got to get a flavor of what we're about. And if you come down, we'll have Jimmy's hot dogs for you. Right?
And he couldn't get finer hot dogs. Yeah.
And so he came down, and we had Jimmy's hot dogs, and he enjoyed them.
That's great. Well, and he couldn't find a finer person than Jimmy's hot dogs down there. The thing is that when you're up there and you have the leadership, they surround themselves with quality people such as you and Terry. And that's always good to know, because a lot of people don't know the internal operations. They only see what happens that day. When you're talking about quality, all right, Hazleton, the Lehigh Valley Hospital, has been known for quality this past year. How do you determine that?
So for us, it's we use Press-Ganey as a metric that talks about, let's begin with patient satisfaction. Because in order to have patient satisfaction, you have to have the quality, right? Our patients need to know they come in to see us, and we're going to handle their case. And they also know that if we can't handle what is needed, that we're going to send them somewhere to a higher level of care, such as the Cedar Crest, right? To get that level that they need. So for us, when we look at our Press-Ganey, which is our patient satisfaction, that tells us, how you're feeling, how are your nurses treating you, how are you, your doctors treating you, is the hospital clean enough, are we giving you the right treatments, are we discharging you in the right manner? And so that really sets the stage, because they know when they come in, they're going to get the quality. And how you get the quality is through, like, the certifications that we have at the hospital. We're a level 4 trauma center. You just don't get that certification. You have to have various certifications and protocols that you have to meet in order to deliver that level of care. The same thing with stroke. We're a stroke center. In that, we are certified in stroke, which means that you come in, there's a guarantee that we have to deliver per the protocols of what happens when. Whether you have your x-ray right away, whether we start drawing your bloods, and from there, if you come in and let's say you're having a heart attack, then there's a protocol that we use. And so again, you'll see that in front of our emergency room because we're proud to be able to deliver that level of quality that we say we're a trauma, we're a chest pain and stroke center. And that is an indication to anyone coming in those doors that there are certain things that are going to happen and are going to happen quick.
Yes.
To get you either taken care of locally or send you, out to our flagship hospital, Cedar Crest.
Okay, I want to talk a little bit more on that, but I just want, how often do you have staff meetings and meetings with the various areas of the hospital so you're appraised of what's going on?
Yeah, it all depends on what's going on. So let's say we have weekly, monthly meetings, but in between that, there's daily stuff that goes on. So let's say you come in crisis with chest pain, God forbid.
Yeah.
We already have an alert. There's an overhead page that says stroke alert, chest pain alert. So we get an alert that says trauma alert. So we know exactly. Everybody gets mobilized. This is where other specialty services like X-ray, come into play. This is an alert that lets us know we have someone coming in very sick, and everybody is ready to handle that case. If a trauma's coming in, you've had a crash or something, the alert, trauma alert, everybody is on, and ready to take care of those patients, those specialized patients that are coming in, because they're life-threatening.
Now, we have other alternate care, that people can go to. And I think sometimes they don't know, should we go to ER, should we go to the
ExpressCARE?
ExpressCARE. How do you make that distinction?
So what we like to say is those things that you go to the urgent care are your sniffles. You may have cut yourself, not excessively bleeding, but you think there's something going on. It's the minor stuff. You wake up, all of a sudden your eye is swollen, those low-grade temperature, something is just not feeling right, so I would attribute it to a little bit higher than your common cold, but not as critical as a chest pain, like you can't catch your breath, those are the critical things that you need to go to the hospital. And so on our website we have the criteria, but I think you internally know yourself, this is something I think I need. I fell and now I can't walk. You probably need to go. Although we do have imaging at the ExpressCARE, really you need to go to the hospital and have that looked. It is a fracture, maybe the bone is sticking out. You definitely need to go to the hospital.
If it's really severe, or if it's something that, however, I said, even if you go to ExpressCARE.
Oh, we're going to transfer you over.
They're going to set you up with a thing like that.
No choice is the wrong choice. Exactly. That's the way I like to say it.
I'm talking to Tammy Torres, hands-on, my friends, and when we say your health partner, we mean it. We'll be back right after this. Welcome back to Your Health Partner with Lehigh Valley Hospital, Hazleton. Great network, my friends. They just keep raising the bar. Remember, my friends, 24/7, ssptv.com. You get to watch all of these health shows that we have. It's ssptv.com. My email is sam@ssptv.com. And for those of you who have sent me emails and asked me questions, we do cover them, such as today. I have Tammy Torres, who is the president here, very hands-on, doing an excellent job in this area, and it's so nice to have her here. We're talking about, just briefly about ExpressCARE, where it's located in the hours about that.
We're open 365 days a year, including all holidays, and from 8 a.m. to 8 p.m. We also have imaging, just a simple x-ray there as well, in case chest rays are needed, x-rays of the chest are needed. Sometimes people come in congested and we want to do that evaluation to see if it's anything in their lungs, so we do have that available for that and also.
Okay. Now, another touchy subject is urologists.
Yeah.
Okay. Now, they have urologists, just so I don't want people to think that you don't cover that. You do have them, okay? We'd like to get some more. So let's talk about what's happening with urologists and where we are right now if someone's in need of a urologist.
So right now, if someone is in need, we do have at the Health and Wellness Center a special virtual hub cart where we can get you in front of a PA to discuss any urological issues that you may be having. So that is available now as we speak. We are currently recruiting for urologists. However, we know the supply and demand, it's a nationwide shortage, but we are fortunate that in some of our areas, like again, our flagship hospital in Cedar Crest, that we have that available. So if you went into the virtual hub, you met virtually with the PA, and he's able to address whatever the issue is, that gets addressed. If you need to then be actually seen, then we would schedule your appointment to be able to go down to Cedar Crest. As we are in this influx now of not having someone here in the community. And certainly, Sam, I have heard from the community that is desperately needed, and we are desperately trying to recruit. We're trying to see how we partner with other hospitals such as Schuylkill and Carbon to, bring someone forth, to work in all three areas.
Well, we invite anyone to come into this area, and as you came into the area and saw the reception and the people and the amenities we have, it'd be great for any doctor to come into this area.
That's what I say.
When they see what we have available in this area and living conditions, etc., I think we got it damn good as far as I'm concerned.
I agree with you.
Let's talk about the future, 2025, pediatrics and pediatric rehabilitation.
So this is one of our strategic plan. We started that last fiscal year, and it's going to be opening hopefully this outpatient rehabilitation for pediatrics. We outgrew the space, and we were at the Health and Wellness Center here on the Beltway, and now we're going to be moving it to a more central location right into Hazleton proper, I like to say, on Vine Street, and making bigger and better and more improved.
Okay.
It's really, we want to gear it to those children that have a lot of sensory issues, just to really give them that environment that would help flourish for them, to be able, we're looking at a rock climbing wall, we're looking at special equipment in there, so I'm thinking probably the end of February we'll have that open, if not before.
So now there's a PET scan at Station Circle. What's a mobile PET scan?
So it is, we put that together. We used to have one at the Health and Wellness Center. I don't know if you remember, that was the original location.
Yeah.
So it's a specialized scanning machine that really scans your whole body.
Okay.
We noticed.
You still have it there, right?
That's the one we moved, and we now have it at Station Circle because we wanted to expand the hours. And we couldn't do that at where we had it in the Beltway. So we moved it to Hummel, to the Station Circle area. And we've been able to expand the hours. It's desperately needed for all of anyone that needs a PET scan, but with the new cancer center, when we opened that, we just needed more availability.
Yes. So what's this story about a retail pharmacy?
So that was something that we heard from our colleagues at the hospital, that they really wanted to have a retail pharmacy in place, and also what we wanted to be able to offer to our community. And so really this was an initiative for our patients and colleagues. What the benefit for the patient would be if you are hospitalized and now have medications that we're sending you home on, you have the availability to just get them set right to your bedside. If you choose the pharmacy, we will deliver right to your bedside these medications, so you're able to go home and not have to worry to have them filled, at a later time. We found that if you wait to have your medications filled, sometimes your episode gets you coming into the hospital before 24 hours. So, and for our colleagues that have their prescriptions, it's just they can get them before they go home or during their shift.
In closing, with so much going on internally, the hospital still finds time to do community outreach activities. And I think that's very important, Let's talk about to name a few.
Yeah, so we did the flu clinic. We have a boutique that we've just put together for those in the cancer center, anybody that's looking to have any type of headpiece. We also did a huge community needs assessment, to hear from the community. This is the things that we're working on. What do you think? What else? So we brought like 65 community members together from all different disciplines, and that was really, we just got some wonderful feedback, things that we already knew, but things that maybe we can do better and maybe have another community needs assessment, and we just did that as well. And that's just to name a few, but we're out there trying to, and you also through your show, we've had, I think, every director and leader from the hospital come and do education to our community, right?
Yeah. What fascinates me, Tammy, is the advancements in healthcare today, and how do you stay on top of that? Like our cameras. I mean, one time that camera was 10 times the size, but how do you stay on top of the current events that's happening and the new things that are happening?
So we're always doing our research, so that comes directly out of, our doctors and nurses that practice education through Lehigh Valley Health Network. And so they bring those advancements down, like we heard about Inspire, right? We heard, this is what's new, what's coming out for those that snore. And so we invested and have that service line now through Dr. Hahn and his partner right at the hospital, but it was through that education of what's new, what's happening in the community.
So I understand you're moving pediatrics.
Oh, absolutely. We're really trying to bring more pediatric practitioners or providers into the area, so we need a larger space. So we're moving them down 2 miles from the hospital into a larger location. We're just rehabbing that area now. It was recently known, or has the radiology suite, so it's in that area now.
Good. There's so many things happening.
Yeah, oh, absolutely. In medicine, you can't keep up sometimes.
Yeah, I'm just saying, could you imagine, you look back when you first started as an RN, and the things that have progressed in healthcare. I mean, it's just fabulous in all areas, in the heart and lung and bladder
everything.
and everything area. So nice to have you on the show.
Always a pleasure to be here. Thank you for inviting me.
Tammy Torres, my friend. She is the president of Lehigh Valley Hospital. Hazleton. You have any questions, any comments? I'm trying to cover as much as I could. Sam at ssptv.com. Remember, we're shown 24/7 on the channel 513 and channel 13, and also 24/7 on our website and our YouTube channel. We will see you next time.